It's Wellness Wednesday on the Rickey Smiley Morning Show.
Dr. Collier, we are happy to have you this morning.
Good morning, Rickey Smiley. Thank you so very much. Rock T, Maria Moore, Special K, Gary with the T, and the Brett, all the morning show crew. Thank you very much and good morning. So, Rickey, we're going to start this segment off. First, we want to express our sincere condolences to the King family on the passing of Dexter King.
Yeah.
Gone far too soon. He was only 62 when he passed after struggling with prostate cancer. Now, we've talked about prostate cancer so much, and we just want to reiterate how important it is. It's always surprising when someone dies from prostate cancer now because we got new research that's introduced new medications to treat even advanced prostate cancer. There are multiple cancer blood tests. There's robotic surgery for prostate cancer. There's a much better understanding of how prostate cancer grows, the genetics behind prostate cancer, and even the racial disparities. So what we learned from the coronavirus pandemic, Rickey, is this. Even when there are medical breakthroughs like the corona vaccine, physicians and patients may be slow to adapt or accept them, just like the COVID vaccine. So when a man is diagnosed with prostate cancer, even with stage 4 advanced cancer, he still is usually expected to survive at least 5 years and probably won't even die from the prostate cancer at this point. After decades of decline, prostate cancer rates are rising, especially in later stages. One, because they changed the guidelines and people are not getting comprehensive physical exams that includes a digital rectal exam and a prostate PSA blood test. So since those guidelines said that you don't have to get those as often, the rates have gone up. And that means later diagnosis, and that means poorer outcomes. So let me reiterate to the listeners of the Rickey Smiley Morning Show. Screening should start at age 40. Unless you have a family history of prostate cancer, then it should start immediately, but no less than 10 years before the diagnosis date of the family member. For instance, if your father or grandfather was diagnosed at age 45, then some recommend that you should start screening no less than age 35. Dr. Collier's personal recommendation is that if you got a first-degree relative, a father or a brother who's had prostate cancer, you start screening immediately. I don't care whether you're 18 years old. You start monitoring your PSA. So proper screenings and proper treatment can substantially reduce the death rate, and that's what we want to make sure of. And remember, Rickey, a healthy diet rich in fruits and vegetables, especially tomatoes, has a profound effect on prostate cancer. And if you listen to the Rickey Smiley Morning Show, you know the benefits of supplements like omega-3 fish oil and vitamin D3 taken at an effective dose of 5,000 international units per day. There you got it, Rickey.
Man,
so now let's go to the listeners and answer your healthcare questions.
Absolutely. That's some good information. Good morning. You're on with Dr. Collier.
This is Michelle calling from Conway. And my question is, I've been sick for like the past 3 weeks. Just congestion, runny nose, sneezing, all the sinus or allergy problems. I've taken allergy medicine. Nothing seems to help. But then I got better for maybe like 3 or 4 days. And after those 3 or 4 days, I was back to congested, runny nose. And so I just want to know, I've been taking my vitamin C and zinc, but what else can I take to help clear this stuff up?
Okay, Michelle, it's a great question. And everybody seems to be experiencing upper respiratory tract infections that are a problem. They are lasting longer than they traditionally do. A viral infection usually will run its course in 7 to 10 days. And after that, if you're still sick or if it recurs, it's usually then converted from a viral infection to a bacterial infection. And if it's bacteria, it's probably not going to go away or get better until you take some antibiotics. So one of the key indicators is if the mucus that you have when you cough or when you blow your nose, if it's clear or light yellow, then it's probably viral. If it's green or brown, then it's probably bacterial. That means you're going to need some antibiotics, and it's just not going to go away. So I'm seeing this all day, every day in my personal practice, and it is amazing how sick people are and how long it's taking them to recuperate from it. Even after they're over it, they still feel weak after a while.
Right. You're on with Dr. Collier. Good morning.
I have seborrheic keratosis, and I just want to know, are there any natural supplements that I can take that can help me?
Keratosis are benign skin lesions, and the only thing you can do is remove them. For whatever reason, some people are predisposed to them, and sometimes as we age, you get more of them. They look like tiny moles, but the thing is that they have to be actually excised. There are several ways they can do it. They can freeze them with liquid nitrogen. They can burn them with either a laser or a thing called a hypercator. There are chemicals that can be applied to them, but it just takes a while for those to work. But it requires, again, a deep dermabrasion to remove them, and they can come back.
Oh, wow. You're on with Dr. Collier. Good morning.
My name is Jermaine from St. Louis. I'm on 2 types of blood pressure medicine, and ever since I started taking the blood pressure medicine, I've noticed a decrease in sexual arousement or anything like that got to deal with sex. And I was wondering, what should I talk to my doctor about, perhaps getting on a different kind of blood pressure medicine that doesn't affect that?
That is the conversation that you should have. And remember this, in all of the books and the guidelines that tell doctors how to treat high blood pressure, the first 2 or 3 medications that are recommended can and will have a negative effect on your sexual function and ability to get a good, firm, hard erection. But there are medications that won't have a negative effect, and some that will even have a positive effect. The recommendation is that you be on an ACE inhibitor or what's called an angiotensin receptor blockers. Named brands would be olmesartan or losartan, and then a calcium channel blocker such as amlodipine or even verapamil. Those medications don't have a negative effect on your sexual function. Medications that can would be beta blocker class drugs and thiazide diuretics. So have this conversation with your doctor now, because there are options that will not impact you in a negative way, because Dr. Collier would never prescribe those medications for a patient, because I would not take them. There's no reason to take medicines that will inhibit your ability to function when there are other options, and there are.
Dr. Collier, man, as always, we appreciate you joining us, man. Go ahead and let them know how they can contact you and reach out to you personally.
Okay, now please join me on my Facebook, Instagram, and YouTube live tonight, 6:30 p.m. Eastern Standard Time at Ask ASKDRMJ, Ask Dr. MJ, where you will see and we'll talk more about prostate cancer and explain to you exactly why you need a digital rectal exam and what it is exactly that we're looking for when we do that. I can be reached on all social media at Ask ASK Dr. MJ, and if you want more information on supplements to improve your health, go to my website, lipodrops.com. And remember, these are the opinions of Dr. MJ Collier, not those of Rickey Smiley, Rock Key, or the Rickey Smiley Morning Show cast or its production crew. Stay. Don't you dare go away. You're listening to Dr. MJ on the Rickey Smiley Morning Show.